right, my name is Peyton. I'll be your nurse today, and what we're going to do is a physical assessment on you. We'll do head to toe, and I'll explain everything that I do. You do have the right to refuse or accept anything that I do, and if at any time you feel uncomfortable or are ready for me to stop, just let me know, okay?
Okay.
So the first thing I would do is hand hygiene, and then I would put gloves on. Gloves are really tight.
Yeah, just grab some from the boxes.
So to start off, we're going to look at your head and your face. So looking at your face, I see that you don't have any blemishes, abrasions, or anything like that. I see that everything is symmetrical. And then now I will move on to your head, your scalp, and your cranium. So inspecting, I don't see any abnormal hair growth or anything like that. When I palpate, does it hurt or anything?
No.
I don't feel any bumps or anything like that. So I do see that their hair is even, and like I said, everything is symmetrical and even on your face. So now I'm going to measure or feel your temporal arteries, okay? They're both equal, they're not bounding or anything like that. So now I'm going to inspect and palpate your temporomandibular joints, okay? So I'm going to feel, and then what I want you to do is open and close your mouth and let me know if it's any pain or anything like that, okay? I do not feel any clicking or anything like that. Okay, so the next thing I want you to do is we're going to test cranial nerve 5. So I want you to clench your teeth and then against resistance, any pain or anything like that. Okay, again, no clicking or anything like that. And then also, I forgot my cotton swab. Okay, I want you to close your eyes and let me know when you feel this little swab.
Feel it.
Okay?
Feel it.
Okay. All right. So we're done with head and face. Now we'll move on to eyes. So we're going to first do the Snellen chart here. So I want you to come stand 6 feet, which is roughly right here. And with each eye, I want you to use this to cover and read the smallest line that you can.
Are you going to tell me which line, or I just start going?
Whichever, the lowest one that you can read.
C, F, D, H, J. It's the second from the bottom.
Okay. Next eye.
D, H, J, B, S.
Okay. So you have 20/25 in your right eye and 20/40 in your left eye. Yes. Okay, so next I'm going to get my pen light and I'm going to do extraocular movement. So I want to make sure that you're going to follow my fingers. All you're going to do is move your eyes, not your face. Okay? Okay, your eyes move symmetrical and I don't see any abnormalities. So now I'm going to check your pupils to make sure that they're equal, round, reactive, and accommodating to lights, okay? So I'm going to use this eye light, so I will have light in your eye, okay? Okay, so they are equal and reactive. They're about number 4, which is good. They're round, reactive to light. I see that your iris is green. Your color green, your sclera is white, your conjunctiva, everything looks good. There's no drainage or anything like that, okay? I also see that your eyelashes and your eyebrows are also, the hair length are growing equally. Okay, so now I'm gonna move on to your ears. I only will do the external ears, so I'm gonna lift your hair up. Let's see if you don't have any abrasions, no drainage, redness, or anything like that. Are your ears hurting you at all? Okay. Okay. Let's see. So now I'm going to do what we call the whisper test. So I'm going to whisper something to you and I just want you to repeat it to me, okay?
Pillow. No.
Okay, good job. So now I'm gonna do your nose, okay? We're just gonna look at it. I see that everything's symmetric, nothing's deviated or anything like that. Do you have any trouble smelling or anything like that? Okay, so then I'm gonna palpate. I feel like everything is straight. There's no abnormalities or anything like that. I don't see any drainage or anything like that either. So now I want you to occlude one nose and sniff, okay? And occlude the other nose and sniff, okay? Everything is patent. So now I want to feel your mandibular or your frontal and maxillary sinuses, okay? So I'm gonna feel right here, pressure, right here, pressure. Any pain? Okay, good job. So now we're gonna do your mouth and your throat. Okay, I'll start off with your mouth. Okay, just looking, I don't see any abnormalities. All your teeth are intact. Your gums and everything are red, pink, and moist. Okay, so I am gonna use this tongue depressor. So out, okay, and with resistance is good. So now I'm gonna do your gag. Sorry, I do see that her uvula does rise whenever we do that, and I see that everything is symmetric, okay? So now I'm going to palpate the lymph nodes. I'm going to start with the preauricular, which are behind. Okay, I don't feel anything. The postauricular, the occipital, the submental, the submandibular, and let me know if at any point any of this hurts, okay?
Okay.
The tonsillary, the cervical or superficial cervical, the deep cervical chain, and then the supraclavicular. Okay, any pain, okay? And then I also did not feel any of those lymph nodes, so there's no signs of infection that I could feel. Okay, so I'm going to continue looking at your neck. So what we're going to do is test the cervical nerve number 2, range of motion. So I want you to do your chin to your chest. Okay, any pain there? Okay, I want you to move your head side to side like this. Okay, any pain? Okay, your ear to your shoulder just like this. Both sides, good job. And then I want you to shrug your shoulders, okay? And then also with resistance. Any pain or anything like that? Okay, good job. So now I'm inspecting your trachea. I see that everything is in line and there's nothing asymmetrical or to the side or anything. So now what I'm gonna do is get you a cup of water and I'm gonna let you swallow, that way I can feel your trachea. Or your thyroid, I'm sorry. Okay. Okay. Sorry.
Can you do it again?
Nope. Good job. So everything is smooth. It's in the middle. It moves very lightly, and there is no abnormalities. It feels spongy. Does it hurt you at all? Okay. So now I'm going to test, feel for your carotid pulses one at a time, and then I'll test for what we call bruits in your throat. Okay. They're both even, they're not bounding, they're not going too fast, too slow, everything feels good, okay? So for the bruits, I'm going to use the bail of my stethoscope because that's what identifies the bruits, the diaphragm wall. Okay, I do not hear any bruits or anything like that, so that's a good thing. So now I need for you to stand up. I'm going to turn this sideways because we're going to get your back. No, just sit backwards.
Sit backwards.
Yes. Okay. So I'm going to raise your tank top. Okay. Sorry. No. Okay. So just looking at your back, I do see that everything is symmetrical and everything like that. I'm going to raise your tank top. Okay. I see everything's symmetrical. Nothing's abnormal that way. What I'm going to do now is palpate. So again, I don't see anything or feel anything. Does any of that hurt you at all? Okay. What I'm gonna do now is called tactile primitives. So I'm gonna ask you to say the word 99 as I touch to make sure that the vibrations are equal. Okay?
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay. Yep. Everything is equal. So now I'm gonna use my little tool here, and we're gonna percuss. So I'm gonna kind of hit on your back a little bit, and just to make sure that the resonance and everything's equal. Okay. Any pain? Sorry, I didn't touch you on that one. Okay. Everything sounds equal there. Okay. So now I'm going to listen to your breath sounds. I'm going to do this with the diaphragm. Make sure that everything's equal. Deep breath. Almost done. Good job. Everything is equal. I don't hear any abnormalities. Okay. So now I'll take this off. You can turn back around to the front. So now we're going to do your upper extremities.
Do I turn this?
Yes, stay right there. So the upper extremities, what we're going to do first is test your wrist. So what I want you to do is hold your wrist out, and I want you to flex. Okay, any pain that way, and then I want you to do like this. Okay, any pain that way. Okay, I want you to spread your fingers out. Any pain that way, and then I want you to do thumb to each finger. Okay, and just for this purpose, the only abnormality that you have is that you do have a partial finger, but with that, you don't have any trouble or anything with it now. Okay, so now we're going to do the cerebellar test. So what I want you to do is I want you to hold your arms out like this, and you'll touch your nose, and then you'll just go faster as you can do it, okay?
I just keep going faster?
Yep. Okay. That's good. Any trouble or anything like that? Okay, good job. So what we're going to test now is the gravesthesia. So what I'm going to do is you're going to close your eyes and you're going to have your palms out, and I'm going to write a number, and you're going to tell me what the number is on your hand, okay?
3.
Okay.
2.
Yes, good job. Okay, so now we're going to test the strychnosis. So I'm going to put an item in your hand, and then you're going to have to identify what that is with your eyes closed, okay?
Okay.
So,
Cotton ball.
Okay.
Do I keep my eyes closed?
Yep, next hand.
Gloves.
Yep. That's all I have gloves. Okay, so now we're going to do your reflexes. So I'm going to test your triceps, biceps, and your brachial reflexes. So for your tricep, I'm going to have you pull your hand out and just dangle this hand. Okay, and we're just going to hit right here. Okay. Any pain or anything? Good job. Okay, for your bicep, we're going to do the inner side of your elbow. So it's just continue to dangle. Good job. Good job. Any pain with that? Okay, and then we're going to do your brachial reflex. So I'm going to take your Apple Watch off for a second. Thank you. So we're just going to do it on the inside of your thumb. Good job.
that one moved.
Good job. Okay.
Do I need to keep this off?
Nope. You're good.
No.
So I believe now. You can go ahead and inspect your abdomen. So I'm going to get you to lay down right here. Raise your belly up. Sorry. Okay. So just by inspection, I did not see any abnormalities. Gotta come down. As I read. There we go. Okay, I don't see any abnormalities. Let's see, I don't see any raises or anything like that. Everything looks even from just looking at it. So now I'm going to listen to your valve sounds. Okay. Your belly sound is normal, active, and everything like that. I'm also going to listen for any bruise or anything like that around your belly. And I would do that with the bell. Okay, I don't hear anything. So now I'm going to percuss. So what we're going to do is we're going to use this again. Any dull areas with like air or anything like that, or blank spaces, they'll be dull. Anything with organs or anything like that, they'll kind of have a resistance to it. Okay, everything sounds good. Okay, so next we're going to do palpate. So what I'm going to do first is lightly touch every quadrant of your belly. If you feel any pain, let me know, and then I'll go into a deeper touch, okay? Any pain there? Okay, so we're going to do deeper. Okay, any pain? Okay, good job. Let's see. Also, I'm going to look, see if I can palpate your liver. Okay, that's something I almost forgot. So it is on your right side, which I did not feel, which is good. Where's my liver? Okay, so now I'm gonna look at the front of your chest. Okay, just by inspecting it, I see that you don't have any labored breathing. I don't see any abnormal rise to your breathing. Are you having any trouble breathing or anything like that? Okay, so we're going to, let's see, palpate and then I'll listen, which we don't have to listen because I've done that in the back already. I don't feel any vibrations or anything like that. Does anything feel painful to you? Okay. So what we're going to do while you're still laying down is I'm going to listen to all your lobes. We're going to do your aortic, your mitral, tricuspid, pulmonic, just to make sure that everything is even, okay? Pull this back up. Aortic. Listen with the bell to make sure that I don't hear any bruise. Don't hear anything. Okay. Next thing we're going to do is we're going to look at your lower extremities. So what we're going to do is you're going to come stand up for me. So what I want you to do is I want you to walk that way, probably to about right here. I want you to walk on your heels and then walk back to me on your toes.
Can I take my shoes on?
Yeah. Good job. Good job. Any pain or feel like you're going to fall or anything like that? Okay, so now I want you to do what we call the Romberg test. So I just want you to close your eyes. Let's see, make sure. Yes. So you just stand and close your eyes. Okay. Do you feel like you're going to fall over or anything like that? Okay, good job. So now I want you to hop on one leg. and then back.
Does it need to be opposite legs?
Yes. Good job. Any feeling like you're gonna fall over, any pain or anything like that? Okay. So now we're going to kind of get you sideways just so that they can see in the camera. So I want you to kind of bend over. Okay, while you're doing this, I'm also gonna look at your back. I don't see any curvature in your spine or anything like that. Okay, so I want you to bend over and touch your toes.
Oh no.
Any pain there?
No.
Okay, so then you can go, what is it, sorry. So you're gonna go sideways like that, and then you're just gonna bend backwards. Good job. Okay, so let's see. With you sitting, you can sit in this higher chair right here. Let's move this out of the way. Can you pull those lights up in? Sorry.
What? How far?
To your knee.
Above my knee or to my?
Just to your knee is fine. Okay. So just looking at your legs, I don't see any abrasions. Do you have any pain in your legs or anything like that? Okay. I don't feel any edema or swelling or anything like that. Okay. So I'm also going to feel your popliteal, posterior tibial, and your dorsalis pedis pulses to make sure that they're not down. Okay. So your popliteal are behind your knee. Sorry. Everything is equal and not bounding. Okay, so while you're still sitting like that, I'm going to use your, I don't think it's going to answer. Sorry, I had a phone call. So while we're doing this, I'm going to do your Bodinsky just while you're on, while it's off the ground. So your toes want to curl in, they don't want to curl up. Okay. Okay.
Good thing about ticklish, because
Okay. So next thing we're going to do is I did forget a couple of things while you were supposed to be laying down, so let's go lay down one more time for me. So what I want you to do is raise your leg each at a time up to a 90-degree angle. Good job. Good job. Okay, and then I want you to flex your knees like that. Good job. Now I want you to twist your knees in and then twist them out. Any pain or anything like that? Okay. Let's see. Okay. So I want you to put your, and then out. And then also with resistance. So pull up and then pull out. Okay? Let's see. I believe that concludes our video. Do you have any questions for me?